In this next video, I'm going to show you how to do the basic Pastern ultrasound. First, I'm going to get into the basics. Then in other videos, in other modules, we're going to go really advanced, okay? The first thing that you do, just like any other lower limb ultrasound, we're going to clip. We're going to clip with a 40 blade clipper. And that's what Damien is doing over here. He's clipping the lower limb. Let me show you how it looks from the other side. So it's very important that all this area is extremely clean and clipped with the 40 blade. Now we're doing the front because we are doing a teaching module, right? But you don't always have to do the front part if you're only doing the palm of Pastern. Now for the purpose of this course, we're going to clip the whole Pastern area with the 40 blade. It needs to be very, very clean, very short, so we have really good contact. And let me show you the equipment that we need in order to perform an ultrasound successfully. For every ultrasound, I want you to come very prepared. I want you to have a ruler, even if you don't use it, a small standoff. You can have a large standoff. I'm going to show you how we use this. You can have an ultrasound gel, tape. You can have alcohol, though you've seen that I don't use a lot of alcohol, right? But you can have alcohol. I know some people use alcohol for contact, and I've used it once in a while. An alcohol spray. A comfortable seat. And in this case, what I'm going to do is I'm going to exchange seats. Instead of using this one, I am going to use a lower one. A lower seat. That way I am closer to the ground. And don't forget, warm water and rags to keep the skin warm. Alright, let's go. Alright. In this ultrasound, we are going to scan the Pastern area. Couple things to remember. The dot is going to go towards the inside. Some people in some states and countries put it on the outside. We, with ISIL and to the Noir, everybody that follow ISIL put it on the inside. Alright, so we're going to divide the Pastern in three series. We're going to divide the Pastern in three areas: proximal, mid, and distal. Right underneath the fetlock, I'm going to show you the first view. What the first view looks like and what the anatomy looks like. Right here. We're going to increase the gain. So remember, look at what I'm manipulating the image so that I can actually get a good view. So right here is a proximal Pastern. What do we see over here? Well, we see that we don't have a complete view of the superficial digital flexor tendon. We have the deep digital flexor tendon right here. This is the straight sesamoidean ligament. And right here we have a feigned view of the oblique sesamoidean ligament. Then right here we have the bone. Which bone is it? So now, in order to have a good view of the superficial, we're going to put a little bit more pressure, and then we're going to slide towards the inside, and we can see here the edge, freeze please, and right here, we're going to see the medial edge, and this is going to divide into the branch. We're going to save it. This is the deep digital flexor tendon, straight sesamoidean ligament. And now this structure that you see over here is called the plica. Alright, so now we're going to do the same thing, and we're going to go towards the outside, the lateral aspect. Good. Safe. Freeze. Now we are going to go to the mid Pastern. Now we can see here that the superficial digital flexor tendon, right here, this superficial is starting to get very thin because it's going to split in two areas. and it's going to split into the medial branch and the lateral medial branch. This is the deep digital flexor tendon, straight sesamoidial ligament. Let's take a look at it again. We're going from proximal pastern. Freeze. Safe. Freeze. To slightly more distal. Now we're gonna go to mid pastern. Look how that superficial digital flexor tendon gets thinner. And then right here, it almost disappears. And we have the deep digital flexor tendon. Notice how the deep digital flexor tendon has two lobes. The medial and the lateral lobe. This is not a lesion. It's just a normal splitting of the tendon. This is the straight sesamoidial ligament. Excuse me, I apologize. This is the straight sesamoidial ligament. I'm sorry. I'm going to save. I'm sorry. Alright, save. So now we're going to put a little bit more loop. Just a little bit. I'm going to continue going down. And then right here, distal pastern. Freeze. We can see how this is the superficial digital flexor tendon. This is the deep digital flexor tendon becomes more superficial. The deep digital flexor tendon becomes more superficial, more towards the surface. Because by this area, the superficial digital flexor tendon already has inserted into the middle scutum. Sometimes when we go to school, they teach us that the superficial digital flexor tendon inserts on P2. There's a little bit more than that. It inserts into the middle scutum, and then that inserts into P. Alright. So this is a very good image right here. This is a good image of the deep digital flexor tendon. If you want to, which I don't always do, you can measure the circumference. Just like this. I have real tight, good contact right here. I know exactly where I am because of the anatomy. Always looks the same. Now another thing that I'm going to do is I'm going to do negative images and positive images. You see, this is a positive image. This is a negative image. Positive angle contrast. This is called angle contrast ultrasound. Just giving you more examples. Freeze. Right here is the straight sesamoidial ligament. Many times these are confused with lesions. The straight sesamoidial ligament can get lesions. Not commonly can get lesions. I suggest you do multiple ultrasounds like this so you can see what normal looks like. Okay? Now look how interesting on this particular horse. This is a distal pastern. And there is some mineralizations. Freeze. There are some mineralizations right here. In more advanced courses, we're going to talk about what could this be. But for now, I just want you to notice that there are some mineralizations right here on this horse. Okay, I never ultrasound this horse before, so I didn't know they were there. Now I'm on the distal pastern. Following that deep digital flexor tendon. Right here. And as far as I can go with good contact, it's going to be right there. Freeze. And that's about it. Remember, the dot on the inside. So now we're going to do one more scan. Can you put the camera from the other side? That way they can see. Now we're going to do one more scan from proximal pastern to distal pastern. Right here we see the superficial digital flexor tendon, deep digital flexor tendon, deep digital flexor tendon. To see the edges of the superficial, I'm going to go inside. To see the outside edge, I'm going to go outside. Now I'm going to keep going down. Right here, the superficial digital flexor tendon starts getting
thinner.
And now notice how the deep flexor tendon is going to start becoming right underneath the skin. And we lose the superficial flexor tendon. I'm going to give you a quick bonus for the advanced course. I can follow the branch of the superficial flexor tendon and find the insertion.
Right there.
Notice that there is an insertion. Right here on P2.
Right here.
That's done to the scutocompedal ligament.
That's done through the scutocompedal ligament.
We're going to learn more about that in the more advanced courses, okay?
In the more advanced
Right now,
courses,
I just want you to go to the normal anatomy, learning the anatomy. Right here, this is the branch.
Right here,
we can go to the inside branch.
We can go to the inside
Right
branch.
there and right there. This is the medial
Right there.
scutocompedal ligament. Then we're going to go and continue down. Down. Look how what the deep flexor tendon starts becoming flatter. We have the middle scutum. We have the mineralizations in the middle scutum. And right here we have the distal. Distal flexor tendon freeze. Excellent. And that is the basic ultrasound of the Pastern. I want you to do many like that. Use these reference images before you start diagnosing pathology. Or if you have a problem with the horse, or you think you have a problem, use these reference images so you can compare. I want this to be very practical for you. If you have any questions, remember, we are doing a mastermind call every week, or write me an email. Alright? So that was the ultrasound the Pastern. Then next, ultrasound the palm of Pastern with the flexor tendons. In more advanced courses, we're going to learn about the collateral ligaments and a little bit on ultrasound foot. Thank you very much.